The taste and the smell of the good tea is coming only when you are going to put it in a very hottest water. If you are going to put in a cold water, you are not going to get the taste of the tea. So when you are subjected to the NEET exam, when you are going to face a tough challenge, when you are sure that 1.5 lakhs or the 2 lakhs people are writing the same exam and you are also going to be put into that test, and there comes your success. There comes your success when there is a water is hot, that you are going to make sure your aroma is coming out. So it is not that the surrounding, it is not the challenge, it is not the problem which is going to determine what you are going to come, but the confidence which you have and how you are going to see into that the pain and again in your life, that is going to be the make sure. Always remember, the end of the door may not be the end. What you are seeing at an end, if you are walking on a street, you may look from the distance, showing that the door end, the last but end is end, but it can be a bent that only it will be visible to you when you are reaching to that point. And looking at behind, you will always see that is a very dead end. Many times the medical students feel that NEET examination is the end of my life. I will not be able to do that. I will not be able to go that. Please remember, you go to that space, see that the bends there. It will be just turning around. It will make you to take you in the right region. So all that will be able to come only when you are going to take a positive or the belief in yourself. That is you are making sure your mental health is going to be in that. The surroundings is not going to determine that what you are, but what you are going to determine that what you are going to get in that. That is to be possible only when you are concentrate and focus on that. Remember, in the medical students, the healing yourself, though we talk about the self-healing, but it is also important, the team effort. The team is that together everyone achieve more. It is not that alone we can succeed. It is with the team. It is how we are going to take the people along with us and how we are going forward is going to be important. So it is, do not try to go alone, but always try to take a chunk of your friends with you, chunk of your colleagues with you. That will always encourage you and empower you, always interest on you and put you in the right perspective of going forward. And do not ever believe that, that you will be rejected by somebody, you will not be accepted by somebody. Remember, if you are going to the shop or a big mall to buy something, I will maybe going and buying a pen costing around 1,000 rupees. We have a Sethi is here, he may get the pen for the costing 20,000 rupees. That doesn't mean when I am getting a pen for the 1,000 rupees, the pen which is there costly of 20,000 rupees is not worthy. Why I am not choosing that? Because I do not have the enough money to buy the cost of the 20,000 rupees pen. So someone is rejecting you, someone is not buying you, someone is not accepting you. Please do not think that you are at fault. That person is not worthy enough to get you. He is not having enough to make you reach to that place. If you are not getting a particular place, don't think that you are not worthy, but it is the person is not worthy to get you. So you must not feel that someone is rejecting me, people are not accepting me. People will accept only that what they can get. I can buy things only what the money I have in my pocket. I cannot buy things which is not in my pocket money. So you are unique, you are special. Always take care that you are going to experience that. I want to say, my dear beloved colleagues, if you want to be healthy, never be serious, but be sincere. The serious people has to be in the ICU, but the sincere person has to be the successful one. At the end of the day, if you can say that I have done what is possible, what is expected of me to the sincerely best possible way, that you are the excellent guy, you are the best guy. But if you are going to read about your outcome, you are going to read about the result, if you are going to only see and decide how you got the result, you are not a person who is going to be healthy, and you will be always in a worried way. It is not the outcome is going to decide, but the process is going to decide that how best you are going to do. It is not that the ultimate gain you are going to get, but how you are enjoying the journey, that is going to get. When you are preparing for your +2 exams, people always say, focused on one thing, look at only one thing, and then you will succeed. But as a doctor, it is not so. You need to experience everything. It is not just looking at only one thing, one goal. It is simultaneously looking around you, simultaneously looking what is happening around you, enjoying every bit of your journey. That will make you to reach to the higher position on that. So please ever do not get stressed out. Do not get burned out. Always go in a positive on. If I ask you to lift your hand, everyone can you do it easily. If I ask you to keep the hand raised for 5 minutes, yes, you will be able to do that. But if the same event I am asking you to keep the hand raised for 24 hours, that is going to be a stress. That is going to be a difficult thing. So stress is one. It can be a eustress, which is going to make you healthy, and if you're going to be distress, it is going to make you unhealthy. So always have stress in your life, always have difficulties in your life, always have a challenges in your life. That is going to make you healthy. It is not sitting idle, but challenging, facing it, making it is going to make you shine more, do better things more and more, and you will become a great person in the days to come. So I am so thankful to you for giving this opportunity to share with you. Unfortunately, my PowerPoint is not working, so that I just shared with you the feeling. But as my experience, coming from a rural village, rising to the state of the National President of Indian Medical Association, one thing I have learned in my life, the success of secret is believing yourself. The success of your tree is accepting the challenge, and accepting the challenge with a positive mind and proceeding with that. And if you can do that, you will feel healthy, you will feel safer, you will be brighter. And I wish all the good future and fortunes for you, and looking forward to see you all in a wonderful, healthy human and citizens in the country to serve others. And we have a word which we say, if you want to be happy, do not get married. If you want to give the happiness to someone, get married. That is true for doctor also. If you want to have a selfish healthy, do not get into the profession. But if you want to give the happiness to someone, happiness to joy to some other, the millions of people going to come with the tears. It's the right profession you have chosen, and wish all the best for your future endeavors. Thank you very much for this opportunity.
Thank you, Dr. Jayalal, sir,
Before
for
Alisha says,
taking our
sir, I
precious
want to
time.
say I am privileged to be able to hear your session live. Actually, it's highly positive, sir. And I think you spoke from heart, not from a PowerPoint. You spoke from heart. I think you have given the most important gems to the students, that it is the journey that matters as a doctor, not the destination, sir. I'm really honored to be, able to hear you live today. Thank you, sir.
Thank you so much.
Definitely, everything that he said came from directly from the heart. And I know Dr. Jayalal, sir, personally. I met him for 3 to 4 times, and he is a wonderful person by heart. And apart from that, the session that he delivered, that would definitely, I think every student must watch it. The way he explained that, self-love is also important. If you won't love yourself, you will reach nowhere. Apart from that, the confidence part. If you know Priyanka Chopra, she's a celebrity, and some interviewer asked her what is the best thing that makes a woman beautiful, and she said what should she wear to look beautiful, and she just replied that confidence is something that you need to wear, and you look beautiful in all the phases in your life. So he rightly explained what is the meaning of confidence, why you need to carry it. And if you believe that you can do something, it is all the mental thing that is there. If you believe that I'll succeed in the exam, you would definitely succeed. If you believe that there's only 7 days left, I can do nothing, you would go nowhere. But if you utilize this 7 days, if you see, you break down, every day has 24 hours, and if you think that way, you will achieve bigger. Thank you so much for this inspiration, sir. And I think it would definitely help the students who are protesting for NEET-PG postpone. I think I'll definitely share with them to inspire them. Thank you so much for joining.
I think the most important thing that sir mentioned was that, it is how you react to the situation. Like, I loved the idea that he shared with, like, if you put a potato in boiling water and an egg in boiling water, they respond differently. One becomes harder, one becomes softer. So it's about your reaction. And I think Professor Jayalal has, I think, wide experience in life and in medicine. I think he is able to put them together. And he's talking not only about medicine, he's also talking about life. So you can apply it not only to this NEET-PG, you can actually apply these principles in life, I think. Sir, any final words from your side? Any one line from your side to boost up the NEET-PG aspirants this year?
No, be confident that you will definitely be successful. These will have a lot of opportunity. I must not only from my personally, and from the IMA also, I would like to thank Dr. Sumar Sethi and his team for an excellent altruistic service which he is doing to boost up the morale of the people to face this very difficult NEET-PG. I wish all the best, and when we have people like this, we are selflessly working for the welfare of our medical students. I think the impossibles can be definitely be achieved. Thank you, sir.
So next speaker and the guest of honor for today that we have is definitely Dr. Sumesh Shetty sir. As you can see, he's a radiologist and he's an educator and author of many books that are inspiring to students. He has been educator for many years and a radiologist that everyone looks for. And he is also the founder and CEO of Delhi Academy of Medical Science that caters NEET-PG, Next, and USMLE coaching for medical professionals. So I welcome you wholeheartedly to this very conference and sponsoring us and having a great span of speakers with us. Thank you so much for coming here and addressing a very good topic, a students-oriented topic, which is educational, that is called NEET-PG and Next, how to go about it and how to serve and stand the changes that are occurring these days, since there's a lot of chaos about these examinations these days. Over to you, sir. Thank you so much for giving your precious time to us and discussing about this topic.
Thank you, Dr. Alicia. And, I think when you gave me this topic to talk about that, how to go about NEET-PG or Next, I was wondering like which NEET-PG should I talk about? The one which will happen in the next 7 days, or one which will happen 1 year later, or so yesterday after the court judgment, my own inbox and my own WhatsApp is all full of, sir, how to go about the final 7 days. And there is another batch of students who are saying, sir, what if it happens in January? How will we manage? So what we are now looking at is we are in a zone where we are in a phase of accelerated change. Now, change is always there, and I will take try my best to keep a crisp talk about how the exam system in India has evolved. And I will also talk about how all this has accelerated and become a bit chaotic in the last 2-3 years, and how it would evolve in the next quarter or next few years. Now, number one thing that we all need to know is that.
So can you just wait for a while?
Yeah.
The live is not integrated. Just for a while. Can you see the live?
Yes, I can see. I think you are not the host now. That is why you might not be able to see it.
Okay.
Should I?
Just for 2 to 3 minutes. Let me just confirm, or else.
I can see it on the YouTube. It's coming. Don't worry.
Okay, then you may go on. Sorry for interrupting.
No problems. See, so the important thing is that this is like whenever the government or the ministry or whenever the exam bodies, they talk about that they're going to change the exam system, the students, they sometimes go into a panic mode and they're like, what will happen? So first and foremost is I want to reassure you, I want to tell you all that they will not ask physics, they will not ask geography, they will not ask chemistry in your next exam. It will remain medical sciences. So first and foremost is if I'm good at my subjects, the changes will affect me less. If I'm only studying and rote learning some MCQs and thinking that this is going to be the pattern always, then I might be in trouble. So let me take you back to what has happened so far, and then I'll tell you what will happen in future. Now, India traditionally had a dual system of examination. Like when I gave my PG entrance exam, we had 2 sets of exams. We had a state PG and we had an all India PG exam. Plus we had central institutes taking their own exams. Like when I gave my exam, there was a separate exam for Delhi PG. There was a separate exam for Karnataka, Maharashtra. And there was a central exam all India. Then AIIMS, JIPMER, PGI Chandigarh, NIMHANS, they all used to take their own separate exams. Now, although, when we look back today, it seems chaotic, but that was the way people were used to giving the papers. And we were studying different set of questions for state exams, which were more factual. more value based or more one liner kinds, and All India exam was slightly more tougher or slightly more on the clinical side. And then AIIMS used to have its own set of favorite topics. PGI would have more clinical biochemistry and genetics into the paper, and JIPMER would always have more pharmacology, monoclonal antibodies, and recent advances in the paper. So this is how the papers used to be. Then, in around 2012, there was a thought to unify the exams into a single exam, which was called as NEET. Now, NEET was not only for PG entrance, it was also for UG. So for UG, there was an exam called as NEET UG, for PG, NEET PG. And for super specialty, earlier there were different exams happening. They clubbed it all into NEET SS. So the changes were always there. The reason I'm reassuring the students here is that you are thinking a change is only happening for you. It has always been a process of constant change and constant evolution. So when the NEET-PG was announced, so there was a difference between NEET UG and PG. In NEET UG, they included the central institutes also. In NEET-PG, they excluded the central institutes. So AIIMS, PGI, JIPMER, they continued to conduct their own exams until recently, where they were merged into a common exam called as INI-CET, the result of which is anticipated maybe today, and we are all looking forward to meeting the toppers. But I hope you see that the changes have been happening around, and the changes are happening to put things into a common platform, or convert multiple exams, multiple type of exams into one standardized exam. This was the goal. Another big change that happened in 2012 was that before 2012, the exams were held on paper. And I've been a spectator in this journey of change of exam. I've been an educator for around 2 decades now. So I saw that at that time they used to have paper with, I don't know how many of you might have given it or not, there were bubbles and you had to black the bubbles. In some exams, you had to put a cross mark in the box. And this is how the exams used to happen. In 2012, they started taking an exam on computers, and that was called as computer-based test. So India's first NEET-PG exam was held on computers. Immediately when the exam was held on computers, I came online on the DAM's Facebook page at that time and the YouTube channel. I said, because the exam is happening on computers, it opens a window for the examiners to ask visuals. Because on a paper, I cannot print out the X-ray, I cannot print out the pathology image without getting it distorted by the ink and the paper reaction. So I said that now they will ask visuals. And a lot of people said, why it would happen and what is he saying? But it was a lot more common sense. So in the first NEET-PG exam, we had around 30-35 visual questions. And thereafter, in every exam, progressively, I see around 25-30% of the question paper would have some visual questions with a clinical stem. So exams have always been evolving. Another evolution that happened recently was reduction in number of questions. All through my career as an educator, I had seen an All India PG and NEET-PG, which was 300 MCQ with a 3.5 hour duration. In the last 2 years, the NEET-PG has been reduced to 200 questions with similar duration, probably with a vision that the question length will go more and the complexity in the question, the image, the stem of the question will require more thinking. So reducing the questions probably increases the length because the time was kept as same. So this is how the change has been happening so far. But let's come to 2020. 2020, suddenly we had a pandemic going on. What pandemic does is it accelerates the pace of the change. Change was always happening. That is what I wanted to, tell you that, people before you also had changes. People before you also coped up with different situations. Like, for example, I am not sure you will understand today or not. When we were giving the exam, the most important thing was to mark question number 39 in the answer sheet at question number 39. If you by mistake mark it at 40, then here onwards, all your questions will go wrong because of frame shift mutation that happens. And you are at 41 becomes wrong, 42 becomes wrong. And you lose out on, entire opportunity of the exam. You could not actually rub the answers also. So different set of changes require different set of, mindsets. So 2020, we have a pandemic, which is accelerating the change. And side by side in India, the governing body, which was Medical Council of India, was replaced by National Medical Commission. with a vision to increase the number of medical colleges and increase the number of doctors in India. Now, there are two changes happening. One is policy-wise, other is world situation with pandemic, everything changing together. Now, how would all this affect the exam pattern? Let's understand. Now, I want you to understand the basis of it so that you are able to, appreciate and you are able to understand the timings. If you increase the number of colleges and if you increase the number of doctors, what is the risk? If in the last so many years, there are some X number of medical colleges, and now suddenly I want to have more massive increase in medical colleges. I want to have a massive increase in number of doctors. What is the limiting factor? Can you let me know in the chat box? Anybody? The limiting factor becomes quality of training. Now, the problem is if you increase the number too much, how will you ensure that these people are adequately trained to handle, just like Professor Jayalal was talking before me, about the life and death of patients. When you see in the ICU, he's not only a person, he's a father, he's a son, so what about the quality of doctors coming out? So that is where the commission in India, they sought and they looked around and they saw the similar model in America, where after you graduate, the college gives you a degree, but that is not licensed to practice medicine. So license to practice medicine is given throughout the world, throughout the developed world, by a medical licensing exam. And that is where an exam at the outcome was proposed, called as NEXT. That means after the final year, in future, and I know there were a lot of students who will ask when. That is a little bit of a difficult question. I'll try to answer that to my best of my ability also. But the important thing is that at the end of final year, the graduates would have to, especially the people who have entered this year in the medical school, who are first year MBBS this year, it has already been announced that they will, at the end of their final year, have a next part 1, which will test their ability of clinical subjects and integrated knowledge of basic sciences. And at the end of internship, whatever clinical skills they have acquired during internship will also be tested with next part 2. That will give them the license to practice medicine in India. So it dissociates for the first time in the history of India degree from license. Like the graduates before you, once you get a degree, the license was automatic. Now you have to pass an exam to get a license. That is the basic essence of NEXT. But important thing is, NEET-PG will stop happening once the NEXT is introduced. That means even your PG seat will be allotted on the basis of your next part 1 score. So you will not have 2 separate exams. If it is difficult for you to understand, you can draw a parallel with American system. US MLE exam, not only if you pass the exam, you get license to practice medicine in America. And on the basis of score, you can apply to various places in America for residency posts also. So the score will become the basis of your PG seat. Okay. So this is how the change is happening. When is a big question. So this year we are having NEET-PG for sure on 20th or 21st of May. The court has already decided. And in the next year, probably, there are like thoughts, and I think we have Professor Jayalal also, and he has talked to the ministry also. Sir, what is your thought? Next year, NEET-PG or next NEET-PG, I think?
Minister has said next January they will have a NEET-PG, but
yeah.
So far it is true, I'm not sure, but that is their stand on date.
Yeah. Yes. And that is the entire, actually, the challenge right now, that there are like different bodies today, and because some of them are new bodies, I think the interconnection will be developing in due course, where like sometimes we see one board is saying something, one is saying something else. But important thing is that 2023 is too early for next to happen as far as the current situation, because we have already seen how there is a group of doctors who were left out in this year's NEET-PG because of the internship definitions. And next year also similar challenges will be there because of the delay in the medical school dates of reopening after the pandemic. So the pandemic has accelerated the change and accelerated the problems, but there is also a change happening at the policy level, which needs a licensing exam in due course. So definitely the students who have entered first year MBBS this year, they will be having next, not NEET-PG. This year we are having NEET-PG. Most likely next year also we will be having NEET-PG. Thereafter, is a little bit of a gray zone, and we will be looking forward to the government announcements in due course, and we'll be updating it on that note. And I hope this gives you the perspective that why this is required and what is the purpose. Now, I see a lot of students panicking that, sir, what is the implication of next? First and foremost, next and NEET-PG are different because next is going to be a mandatory exam, a mandatory licentiate exam to pass. NEET-PG is an optional exam. This is, into my mind, the most important change. Optional means that if you want to become a postgraduate, you will write NEET-PG. If you don't want to, you are okay. You can start practicing as an MBBS doctor. But next introduces the element of essentiality, element of mandatoriness to the exam body. That means if you give the paper, then only you are allowed to practice medicine in India. It has implication for foreign medical graduates also. That, as of now, the students who are going abroad, when they come back to India, they appear for an exam called as FMG screening exam. Now, even they will be appearing for next for their licensing purposes. So it has, again, you will notice the goal is to simplify. Every successful organization, every successful country keeps evolving and keeps simplifying the, you can see similar simplification happening in the tax structure also. Like, I don't know if, many of you at your age, you might have actually forgotten there were different types of taxes, service tax, sales tax, different states were different taxes. Then they merged it all into GST. So it's an attempt towards simplifying the exam system to a single exam, which is serving multiple purposes. It is licensing for Indian medical graduates, licensing for foreign medical graduates. It is a PG, the score is also used for PG seat, and it is testing both. First time in India, it is testing even the internship skills, which was so far we had a pure MCQ based exam. Now, how as a student would you look at the change and how would you prepare for uncertainty? And this is the word I actually wanted to talk about to you today, uncertainty. This is something that, many people, they ignore in their plannings and in their lives. We're making a plan based on a perfect life, perfect situation, perfect world. We do not anticipate that a pandemic can come. We do not anticipate that, there is a Russia-Ukraine war, which can change the dynamics of the world. We do not anticipate that the world can also change. Even if you do not move from your seat, still the things around you can change. So there is some level of uncertainty in what is going to happen, what will be the pattern. And that kind of disturbs us because we are used to a perfect world, which we see on TV and Netflix and all the stories and Instagram, people showing beautiful holiday pictures. The real world has uncertainty, and successful people, they include an amount of flexibility in their plan to accommodate uncertain changes. If you don't have that flexibility, you suffer. We have seen this with many startups also this year who had no gap or no space for uncertainty in the capital availability. They had no idea that the world would change. And I don't know if you read in the news, there have been thousands of layoffs in many startups in India because of that element of uncertainty that you do not calculate. So as a medical student, I want you to have that flexibility. How will you have that flexibility in preparation? I'll tell you my example. When I used to study as a medical graduate, in my every notebook, like I used to make notes like anatomy, biochemistry, physiology, pathology, medicine. I used to make my own notes based on what I could learn from teachers, what I could learn from books. I used to make my own notes, and that is the similar philosophy I recommend in DAMS to all my students also. In my notes, I used to have flags where in anatomy, I had a flag at neuroanatomy, cardiac anatomy. So neurology, cardiology was flagged. In medicine also, it was flagged that this is where my neurosciences is, this is where my cardiac sciences is, and in pathology also. So all my subjects all my book copies were subject-wise, but my labels were system-wise. So when I was reading for the first time, because the professional structure in India is subject-wise, I would read everything subject-wise. But in my final revision, I would open the same system in different notebooks. Now, what would happen is I would open neuroanatomy, neuropathology, neuropharmacology, neuromedicine, everything I would go through together in the final go. This would help me to connect the dots. Now, you might be wondering that why this is so important. If you forget everything that I tell you today, and you remember just one word, that the subjects that we have divided in medical curriculum, in MBBS curriculum, is a artificial division made for ease of teaching and learning. Human body is one. A patient has a pathology, he needs pharmacology, he needs a surgery, he has medicine. So everything is happening in one person. It's all connected together. So in the new pattern of exam, the most scared the students are is like, what will be the proportion of different subjects? Like for example, today in NEET-PG, the third and fourth year get around 60% of questions, and first and second year is around 40% of questions. And a lot of students get worried when they think that this proportion is going to change. And to the best of my understanding, when the next is going to be implemented, it is going to end at the final year end. So the proportion of third and fourth year subjects would be higher. It will be higher. So if the proportion of third and fourth year will be higher, that means the proportion of first and second year will go down. But then how will you handle it? You will handle it if you are studying system wise. And that is the mantra for USMLE exam. That is the mantra for Indian exams. If you are studying system wise, like I'll give you an example how we do our DAMS, live classes on the eMedicoz app. How do we do the classes nowadays on the app is we have a neurology class. Then we, after the neurologist has taught neurology, we get a neuroanatomy person the coming day to explain the anatomy part again to the students so that they can back correlate everything happening. Then we have a neurophysiology class, then we have a neuropharmacology, neuropathology, and we connect everything together. That is one thing that I have learned, that if the difference between people who are doing well in the exams, who are topping the exams, and people who are struggling is people who are topping the exams are able to seamlessly integrate in their mind different subjects, because the distribution of subject is artificial. Like, you have to look at heart with a 360 perspective. Suppose this is your heart. Anatomist is looking at the structure. This is coronary artery. This is the atrium, is the appendage. Physiologist is looking at the function. Medicine person is looking at the treatment aspect. Surgeon is looking how to operate upon. But if you have a 360 perspective, that means you can seamlessly understand what is going on there, and you will actually be helping the patient a lot. I'll give you an example here. I'm sure some of you would resonate to this also. There is a web series on Netflix called as Good Doctor. In this Good Doctor, this doctor is Sean Murphy. Now this boy has the innate ability. He's having this innate ability to think 360 perspective. So as soon as a patient walks in, they show that around his head, he is able to see that, okay, this is what is happening in him physiologically. He's able to understand what is the anatomy. He's able to prescribe. And then his mind is able to look at various surgeries which are available in his surgery textbook, and he's able to find out the right approach to go in that patient. So that 360 approach, although he's a character in a movie, but that 360 approach is what differentiates great doctors from average doctors, great toppers from average rankers. 360 approach, the connecting the dots kind of approach, the integrated approach. Now, once you have this integrated approach in your studies, you will be surprised that the pattern of exam will no longer affect you. Now, what will happen? Like, suppose they are asking you integrated medicine question or anatomy question. Like, I'll give you an example. Like, recently they had a question in the exam where they asked about a person with a cardiac problem comes to you with dysphagia. A person with a cardiac problem, unknown cardiac problem, comes to you with dysphagia, and one of the cardiac chambers is enlarged and compressing the esophagus on a barium study. Which cardiac chamber would that be? Question. So what kind of question is this? This looks like a clinical question. Patient has unknown cardiac disorder with dysphagia. Barium study shows compression on the esophagus. So, but which chamber would it be? Now, when we think in an integrated manner, it looks like an anatomy question. Why? Because they are asking based on the location, which cardiac chamber is posteriorly located and related to the esophagus. What do you think? Left atrium. So we know by now, when you go into the anatomy department, remember they ask you to hold the heart like this in the anatomical position so that the right ventricle is anterior, left atrium is posterior, and left atrium is the most posterior part of the heart. It compresses the esophagus on the barium study. So in one question, they have integrated radiology, anatomy, medicine, and they made it seem like a dysphagia question, which seemed like a surgery topic. So what happens is when the exam becomes conceptual, exam becomes integrated, the boundaries between the subjects that get blurred. And that is what I have been, believing in throughout my life as a medical student, as a doctor, and it has helped me in multiple ways. I would say that this is just one thing that has made me whatever I could do in my life. I got a All India rank 4 in my All India PG exam only because I had that system-wise approach at that time. And today also we have been able to teach so many students in so many years, and we've been able to deliver results. And today we are standing 22, 23 years tall today, just because I believe in this system-wise philosophy. Why this helps me is because it makes me immune from the changes in the exam system. Like suppose you call a body from America to conduct the Indian exam. Still, we would not be affected because we are talking about systems and concepts. This is the same mantra I want you to hold in your hand. If you are understanding concepts, if you are looking at it in a system-wise manner, you are not affected by any change in percentages of the question subject-wise distribution in the paper. Another important thing is that this is going to be a next big thing in the education system or in the exam system, which I would call a skill. Now, already the government has anticipated that when they will increase the number of MBBS seats, the level of outcome will have to be tested before we allow them to practice. That is where the next is slated to happen. And it is already announced for this year's first year MBBS students. Now, what about the skill that they will acquire? So that skill will be tested by next part 2. And I believe that India is a heterogeneous country with heterogeneous facilities available across the country. About, different colleges, different hospital would have different strengths of patient-student ratio, different kind of patients. But so what will happen to their skill? So I believe that is the place where again technology will help to fill the gap. Like I am a firm believer as that technology will be the enabler which will open the doors to help it will help to connect the different kind of scenarios into more standardized method. And I feel simulation will be the most important thing at that time. Simulation means that at DAMS recently we have started a simulation lab in our Delhi center where we are training our students for, like when we are teaching them CPR. Now we are no longer teaching them, we are asking them to do it themselves on the mannequins. So we are telling them CPR, we are helping them with the intubation, we are helping them with Ryle's tube, Foley's catheter. And this is our first batch of DAMS sim, and I'm hopeful, and I feel that we will continue to make that meaningful impact in skill domain also. And in future, even the skill will be tested in next part 2. So the exam system, this is to the best of my understanding how the exam system is going to evolve. And I've given you my reasons also that why I think they are evolving in that direction. Because when the number goes up, considering the heterogeneity in the Indian medical education system, there has to be a standardized examination. If I look further into it, even beyond what is right now in the policy, I feel that there will be a role of CME also, a big role of CME also in future. And on the DAMS online platform called as eMedicoz, I have recently initiated a CME platform where we have shared small CMEs on hypertension management, ECG interpretation, and some interesting CMEs are lined up for our students, like we did one on COVID management also during the pandemic. Because I feel that even when you graduate, do not stop learning. That my entire challenge is that, and I totally resonate with what Professor Jayalal was saying before me, that look at medical career as a journey. Look at it as an ocean which you are swimming and enjoying the swim. Don't think that you will only enjoy when you reach the destination. Stop becoming a destination hunter, somehow the system has made you, because when you were in school, they told you that once you pass the pre-medical test or the NEET-UG, everything will be easy. And then when you realize that MBBS is going to be a big career, it's an ocean, then you kind of you feel that what is happening. Then I come into picture and you come to DAMS and I tell there is NEET-PG is going to be there. Then suddenly you're like, one more exam. Then later on you will realize after MD and DNB also they will take an exam, which unfortunately some of the MBBS graduates are not even thinking about right now. Then for super specialty also there will be exam. Then even when you become a doctor, to your surprise, my dear children who are listening to us today, even when you become a doctor 20 years later also, like me today or Professor Jayalal, we still have to study. So that you will have to continue your medical education throughout life. That is where I feel CME would also play a part in future, even bigger than what it is doing right now, because the doctors would need to stay updated more. And if we look at the West, in America, there is a certain number of CME credits. In this developed world, there are certain number of CME credits, and even at different places, there are even exams to be taken at due course to tell to the system that you have updated yourself to the current standard of knowledge. It might sound scary to you, but you have to remember what is the end goal of your being a doctor. Your being a doctor is to help the patient. What is it you are getting out of it is a different question altogether, but the goal is to help the patient. To help the patient, you need to be updated in your knowledge. There is no, like, if I tell that, okay, when I was doing my MBBS, I was not taught about COVID, so I cannot treat. It is not acceptable, because new diseases will keep happening. There will be new variants which will keep coming, and the pharma industry will change the entire drugs which will be available 10 years later, which you will not even know, because they are not there in your pharma book. Why they are not there in your pharma book? Because they are not yet discovered. Probably you will be one of the candidates who will discover something. So change is normal. Only thing that has happened in India in the last 2-3 years is pandemic, the governing body changing, the exam. So it has accelerated the change, while the change was always happening, and it will always keep happening. So way I see medical education is, I see it as a journey. And I want you to, and probably I'm repeating what Professor said earlier to me, is like, I want you to detach yourself from the outcome. That outcome, that degree outcome that has, is pushing on your mind that now I want to become this. Like, enjoy the journey. Everything else will happen by itself. For outcome of, how much money you will earn in life, how much cars will you own, which degrees, how many degrees you will attach to your name, will not matter if you are enjoying the journey. Everything will happen to people who enjoy the journey. Every year when I meet the students who have topped the exam, who have got a great rank in the NEET-PG exam or INI exam, I hear many of them say a simple line that when they were giving the exam, they were enjoying it. And I said, why are you enjoying it? Sir, maza aa raha tha, kya badhiya question puche unhone. You understand? So that means he's enjoying the process even while giving the exam. When the examiner was throwing a curved ball, he was excited. Okay, now let me hit this ball also. So that joy of enjoying the journey, that joy of, facing anything life throws at you. Life will not always throw a straight ball at you. There will be curved balls. There will be difficult situations. There will be situations which are not made by you, which are, but still will happen to you. This is uncertainty in human life. It's like you're not in control of everything that happens around. You're not a robot. So there will be things which will happen around which will affect you. What matters is how you react to them, how you remain true to your purpose. And probably that is going to be my final touch here. Before I think there are some questions. One is that, will the next be based on MCQs? Yes, next part 1 will be a MCQ exam. Part 2 will be a skill exam. Part 2 will only have pass fail as outcome. Part 1 will have score given to you. So before I end my talk to any questions that you might have, my suggestion to you in life is that, there will be things happening around you. There will be changes happening around you. There will be ups and downs. There will be people who will doubt your ability. There will be, like, you will be traumatized. You will lose big in life. Sab kuch hota rahega. But if you can just remind yourself of the purpose, why you entered this profession in the first place. If you can keep that purpose in your pocket as a compass, and every time, somebody will say, "Arey doctor kya kama lete hain, kya hota hai?" Just remind, okay, I have a purpose. Yeah, I know that. Remain true to your purpose. There will be people who will keep telling you negative things. People who will keep, telling you wrong things. You will always feel down. There will be things which will go wrong. Matlab, jo bhi socha hoga, sab galat ho jayega. Lekin if you have a purpose in your mind, in your heart, not in mind, in heart actually. So you will, if you remain true to your purpose, you will find a way back. As an individual, as an organization, I have, my purpose is I love teaching. Those of you who know me, I love teaching. So when the COVID pandemic came and all our physical classrooms were shut down, but I love teaching and I love technology as an enabler also. We were the first people in Indian, I'm very proud of this, in the Indian medical education test prep industry to start live classes on the app. Immediately, I think within 7 days, we shifted to live classes on the app, and we and the students, and I asked the students, I came live on the app and I said, this is the first time we are doing a live class on the app, but we are doing it in the middle of pandemic. Everything was shut down. It was like a curfew happening in Delhi. And I said, I am doing it from my home. Internet in my home, it may not be good, but I will try my best. I want you to support me. And all our students also enjoyed. And that is how we evolved. And today we have like sometimes 70, 80 parallel classes running on the app. So if you are true to your purpose, you will find a way. The world will stop, but you will find a way because you have a purpose. So I feel people who have strength of purpose are able to withstand, anything adverse that happens in the life around them. So that is my final message. I wish you all the best. I will request Alicia, and if she has got any questions from the audience, I will try my best to answer. Thank you.
Thank you so much, sir. Well, there are a lot of questions in the chat box I can see. As NEET-PG 2022 is not possible to be postponed, what to do now?
Definitely. So first of all, one mantra in my life is I know that I cannot roll back time. So I always look forward. So if you were not at the stage where you were not preparing for this paper, or you were occupied in counseling and everything happening, but now you know that the exam is going to happen on 21st of May and you have like fixed amount 7-8 days, why not make a plan for these 7-8 days? Why not, like in DAMS we conduct a session called as DVT, where we keep only the high yield topics of each subject and revise entire MBBS subjects in 3 days. So why not do something like that? Revise only the high yield topics. You can use the DVT if you have. And secondly, revise the previous year questions. Revise the previous year 3-year questions of NEET-PG, so that if something repeat comes, you're good and you have already seen the high yield. This can be done in the last 7 days. And please give 2 grand tests, one every 3 days, so that you build up your stamina before the exam. Because most people, even intelligent students, why would one intelligent student have a rank higher than the other? It is about the exam skill. One student has a better exam skill, will be able to do it better because he's have a better stamina to sit for 3 hours, think. So why not build that stamina in 7 days? So my strategy for the 7 days, final 7 days, is revise your high yield topics from every subject. Do not look at completing everything. Focus on high yield because you have less time. Look at previous year 3-year questions, and also give full course exams, at least 2 or 3 in the 7 days, so that you build up your stamina before the exam.
And the next question is, as the NEET-PG January announcement is made for 2023, is there any chances of next coming in 2023?
Now, it looks like that next year we should have NEET-PG so far, based on what has been said by the ministries and by the respective bodies so far. And it looks like, they are targeting January, but according to what I see happening across the country, where different students and their internships and their final years are already delayed, from May exam this year to go to January next year might be a little tricky. So I feel it might happen in March, but let's see how it goes. In India right now, it's like we are not, it's like you can't say that exam will happen in January, because there are different bodies. Like there's a ministry, there's a body, NBMS, which is going to, they're going to conduct, make the rules together. Plus then there is a element of different state bodies, different colleges, and then there are student bodies also, and there is judiciary also. So everything put together would make the final call. I think March would be more ideal. I am sure Professor Jayalal will start getting a lot of petitions by students that January is too early. It is in 6 months, the internships of this batch will also be affected, and the counseling of this exam, again, same vicious cycle will happen. Let's see how it goes.
The same thing has occurred even this year as well. The
Yeah.
Supreme Court denied the postponement just because they want to, the COVID had a lot of lack in the system. So to fill up the lack, maybe there is a possibility in January, but let's see. Definitely students will protest for sure.
So it's not easy. It's not
Now,
easy to predict the date, and everybody who's preparing should have in mind that let's finish our syllabus till January. If it gets delayed, you should get extra time to revise.
yes. What about will 2024 there will be next or not? Will they face next or not?
I think 2024 batch should wait for further clarifications by the government.
Okay. The next question is how to deal with such mixed questions, like integrated questions.
Yes. So when you start this ability, like I'll explain to you, it is a very important thing that when you are in your first year MBBS and I ask you to integrate with medicine, you cannot do it. Why? Because you have not learned medicine so far. So integration always happens when you look backwards. That means in life, when you're going forward, you may not know why you're doing this, what is happening to you today, why are you doing this, but when you will be at a good point in later in life and you look back, you would see the dots will connect together. Similarly, in MBBS, when you will look back after internship or after your final year, once you've done your clinics, when you look back, it will make sense to you. So I get this question very often by first year, second year MBBS students who will say, sir, how do I integrate? So you cannot integrate. You have to trust your teachers. You have to trust your mentors to help you integrate at that stage because they have seen the full journey. But when you become final year, like when I was reading, after my final year MBBS, I had done after reading my medicine, in my internship, I started reading genome physiology. And I was surprised. I said, ये तो सारा medicine उन्होंने first year में पहले ही बता दिया था. And why did I not see it? Because I could see it only when I reached that point. So once you finish your final year subjects, you will be able to integrate your own self by looking backwards. But in your formative years, you should depend on your mentors, your teachers to help you. In DAMS, we have initiated a course or a program called as integrated rounds every week. I call it two teacher perspective. So every Wednesday on the app, we have two teachers sitting together discussing one topic. Like last week, me and Dr. Achin, we discussed ring lesions in the brain. So we discussed different scenarios where you could have neurocystic sarcosis or if a patient is HIV positive toxoplasma. So all those things. So initial phases depend on your mentors because they have seen the path. They can tell you what to expect. When you end your final year, you will be able to look back and connect yourself also.
Thank you, sir. The next question is, will next one and next two be an MCQ exam?
Next one will be an MCQ exam. Next part 2 will be a practical exam kind of scenario where it will, because it has next part 2 is slated to be a pass-fail verdict. So that means it is not going to have MCQs. It is going to be a clinical skill testing that what did you learn in your internship.
And so next one, the exam next one, will that be after your second prof, like second year of MBBS? And how it is going to be implemented? This is,
I think there is some, there have been different, announcements by the board which have slight contradiction. There is one school of thought which says, and which has been the most consistent, actually, the announcement that there will be next part 1 at the end of final year. But recently there has been one meeting where they said that at the end of second year, there will be next part. One would have the initial step of basic sciences, and at the end of final year, the part 2 of clinical sciences. That is yet to be clarified. I think let's wait for those announcements and that timing to come. But if that happens, that will again emphasize that we need to be good at all subjects, and that is one reason that I keep emphasizing to every student that do not look at the pattern proposed. Make sure that you are trying to be good at every subject and you are able to systematically integrate these subjects.
Sir, if the next one exam occurs after second prof, do you think the syllabus would be just first prof and second prof or all the 19 subjects?
If it happens after second prof, it will have only first and second year subjects. But the only challenge is if you include clinical integration to it, like if you draw parallel with USMLE step 1, at DAMS we have program for step 1 USMLE also, and I've been deeply involved into that teaching program. So in USMLE step 1, it is a very difficult exam for a traditional Indian graduate, because we are reading very factual kind of anatomy, and they are asking everything with a clinical blanket. While step 2 CK in USMLE is very easy for Indian graduates, because we are reading Harrison and Bailey at very good depth. So if I draw parallel with that scenario, step 1 USMLE, every question starts with a patient. Patient comes to you with this, although it's a question on anatomy, physiology. So if they include the element of integration, then there is a, there's going to be a little bit of learning curve for the students, especially who are from peripheral medical colleges.